Welcome. I'm Dr. Michael Rowane. This is another series from TOPKI, Training Osteopathic Primary Care Educators. This is a series of presentations that we're having to highlight unique things that may assist osteopathic educators in multiple settings. Today, the topic we're going to talk about is procedural teaching pearls in osteopathic manipulative medicine. In the old days, we said beyond see one, do one, teach one, which many of us were trained in. So we'll go through some areas to looking at this. I do want to acknowledge that these slides were also helped develop from one of my colleagues, Dr. John Jones, who is the chairperson of Osteopathic Principles and Practices at William Carey University College of Osteopathic Medicine. Well, kind of our goal today and objectives in that is to look at all the core concepts and successfully teaching procedural skills. But we're looking at something uniquely. As osteopathic physicians, we're also trying to apply osteopathic concepts in using osteopathic manipulative treatment and looking at it in clinical settings. And how can we utilize that? I think hopefully we'll get some areas to kind of assist our teaching techniques to improve how we do that and to understand that in going through it. I think we could look at history. A.T. Still was the founder of osteopathic medicine. And when he founded the school himself, he in 1892 in Kirksville and died in 1917. He looked, himself, when they looked historically, when it hit the turn of the century, most of the students, were only utilizing a few of his technique modalities. And they really weren't being taught as much as late as 1915. Now, some people mentioned that Still himself didn't want people to just be focused on his technique, but applying things themselves. But we can even see from our founder that sometimes the old see one, do one, teach one didn't keep perpetuating and going through things. Well, where are we at? In medical education, we start off didactic years and begin just learning themselves. And you tell people in the beginning, what you expect them to learn. Now, the whole process is, how they're expected to learn themselves. And you want to look at materials and everything that you're giving as an educator to help support that learning process. We're looking at developing, learners in action, learning themselves. An area that learners are always asking us to do a better job with is evaluating them, giving them feedback, and knowing their expectation. That's why we have to be very clear of how we're going to test to make sure that they've reached that competency. Again, we look back at our learners, we're developing them as novices to develop basic skills, to become competent physicians, and move towards individuals who have expertise. And you want to test them to make sure that you're really, they have kind of learned things, and they've also been told what they're going to be tested on. Learners don't want surprises. The challenge with osteopathic manipulative treatment and learning this is a psychomotor skill. And it's not the same as just learn these facts. People have got to honestly apply things to doing it. So when we look at that, we have got the cognitive level themselves, understanding the concepts, the effect of how they really enact those things and understand themselves, and psychomotor, how they're able to do themselves. So again, we're looking at knowledge, we're looking at attitude, we're looking at skills in those areas themselves. And that's how, bringing from an osteopathic medical student all the way through residency, fellowship, becoming attending, going through that whole process, what we're doing. Many times we get caught up in the whole educational jargon all the time themselves. And, we look themselves as, content knowledge. The move now is to really move people more to being process expert. How do we help people transverse, again, from novices to becoming competent, developing expertise? Again, education, a dynamic education themselves. The challenge is that many of us have not been trained to think that way or be part of things themselves. And we're not familiar with some of those terms. And I'm going to just go through a few to give you a sampling of things we have to think about. They're also looking at criterion reference testing, norm reference, mastery test, high-stakes tests, and understanding those concepts I think will make us more effective as educators. So let's take a look at norm, which is what most of us kind of brought into school with and trained with, and now it's moving more to a criterion reference test. So we think of things like norm, it's kind of the ranking. Did you do better than this other person? Here are the best people, here are the not people. It's kind of like, is it good, is it bad? Did you get, the good people answer the questions, the people who didn't understand it, they missed it. They're the good, they're the bad. So it became very much in that direction. To be competent and develop a clinician with expertise, we're looking at a whole different approach. is not just good or bad, but also, do they master? Do they understand that material? When they answer questions, did they do that correctly in the process of that? How do they get to that level of achievement? You want to make sure that you will find ways that shows they really understand the material. And there's also standards. What do we expect someone to be a good physician and a good osteopathic physician, taking care of patients and looking at that rather than just knowing the answers? So when we're looking at all those areas themselves, again, these are key things we're looking at. So when you look at this mastery test, one thing about these criterion, don't have an outscore. There are certain things. There's a certain thing called cut score. If the individuals meet that certain level, we can't get rid of this themselves. Our board exams have to differentiate, does someone make a certain level or do a certain level themselves? And Criterion doesn't look at that themselves. It's, they're looking at where, we're looking at where in Criterion, the level of mastery people should be at. And the score themselves may just say where people are at in relation to other individuals. So again, the Criterion is looking beyond that. When we look at clinical skills assessment exams, for example, themselves, we may look at different situations. We may look at how they can apply different procedures or protocols or procedures. We may themselves, which elements of that develop some competence. There are certain critical elements to doing things, and we can evaluate someone to make sure they have those behaviors themselves. And some of these, performance tests, may or not have these cut scores themselves to go through that. A better way to take a look at this is, kind of stepping back and looking at, again, the psychomotor themselves, in domain, because this is an area where you really have to have individuals that really understand it rather than can just recite things. You want to look at a set standard. Again, how, when you're looking at manipulation and training someone else for manipulative treatment, there's a certain speed, there's precision, there's distance. They understand that three-dimensional concepts of doing things. There may be, those elements going through it. When you're performing any procedure, there are certain elements that we go through to do that. And we have to make sure they can go through those specifically. And can they fulfill that? There are certain high-stakes things that we go through as physicians. We have to make sure that we do that. You cannot finish osteopathic medical school without passing COMLEX. And understanding the National Board of Osteopathic Medical Examiners, it's been set up basically for the public to ensure that we have competent physicians going through that. We're also trying to train people for the actual practice of osteopathic medicine. And they have to meet these areas, these high-stake tests, but also if they get through that, it's beyond it. One comment here is that each patient is a high-stakes test. We have to make sure we have people, when they're training and they're taking care of our patients, that they're honestly doing a good job and that they are competent physicians. So maybe kind of step back. Let's ask the big question itself. What does it take to be successful in teaching procedural skills? Well, let's look at ATLS. Very common, been around for a period of time. ACLS, other models are doing it. They base models and look at studies of them. George and Dodo did studies and evaluated the effectiveness of this. They gave an overview. They gave a silent demonstration. Then they'd repeat the process to the learner, but then they'd give details of what they're doing with each step. They'd have the students talk through the skill and then perform the skill. So you can see multiple repetition, but keeping that sequence, again, because procedures require many times that sequence of events and understanding it. So their success themselves in that feedback going through it, go through multiple levels. The ability to do things, their attitude, and develop the psychomotor skills. So what happens, sometimes you get people, and if you're in any learning situation, that they give that kind of deer in the headlights look. And they're going through things, if they're having trouble getting this and understanding it, think about why are they not understanding this? Well, there's a lot of things. There's a whole area of the learner and people with different learning styles, and maybe we're demonstrating they're not understanding it through that. Maybe our approach and training in that is fine for a good number of people, but other people, is not adequate, and maybe they need to have it demonstrated in a different manner going through it. Many times we're demonstrating that maybe we're following correctly. You may not be the first person who showed them something, and maybe the person before didn't exactly show them the right way to do things. And they may have been imprinted in the wrong direction, and referring to that. And so or a technique or approach that is no longer acceptable or doing it. When we're going through and learning things also is that maybe it's not been corrected before or appropriately reinforced to do that. There's other factors with that. And there are many learners that sometimes come through and say their perception is they're doing well, but they're not exactly doing well, and it's our responsibility overseeing them to give them that feedback, and that's important. As we know, that the one we call the quadrants of looking at things is knowing, unknowing, competent, and incompetent, and the scary person is the person who is unknowingly not competent, and we have to pick those people out as we're going through things. The next question we look at with this is, what are unique considerations in procedural skill acquisition we're applying to neuromusculoskeletal medicine and osteopathic manipulative medicine? And let's look at two different perspectives. Let's look at the perspective of a learner, and then it's also think of the perspective of the teacher, because each one has different elements that we're looking at, and their perspective interact how we're doing it. When we look at the student, we're looking at an individual that may be new to a technique or new to approach or utilizing this. When we look at the instructor, we may have someone that may have expertise, or may be more of a novice themselves in a procedure, but even an expert is not certain what are the best ways to approach and to be effective at this. When you look to the next thing after you look at the perspectives of our learner and ourselves as educators, how do you implement teaching specific techniques to improve their ability to understand specific osteopathic manipulative techniques? And those are things we have to go from. Again, we're trying to look at the Covey thing, look at the end in mind. What is your outcome? What's your final goal? We want to have someone that has developed, competency in the area of osteopathic manipulative treatment. Then we got to look at what is required to meet those standards. This is where we have to look at that evaluation. We can look at that feedback. We also look at some concepts of formative and summative. So again, think of this as formative as a safe area in the process of doing things, saying, let's go through this. And also tell the learners, this is a low stress situation. That's to make sure that you can perform this technique and approach this. The summative is at the end, because we're going to have a practical to make sure you understand that, which, puts a little more pressure, but at least they have that end in mind themselves. And we're going to give you feedback throughout the process. So again, that formative procedural testing, you want to make sure they're getting feedback going through it, and you want to give them feedback through the process, And as someone say, you like to hear that do or die situation again with summative assessment, but the idea is they have to demonstrate that they can meet that, at the end. Well, how do you do it? Well, then you look at yourself in your teaching role and going through it. We want to look at people that develop critical thinking. And to do that, we want to reinforce the good things they're doing, and we want to correct things that are not there themselves. So an evaluation and feedback, again, we're looking at formative, so as they're going through the process, guiding them, and add that summative. And that summative means to document that they want to see maintain those skills. And this, again, goes from a school when a student is in their first practical in osteopathic medical school to someone who's in a residency and fellowship. We're documenting they have clinical skills in osteopathic concepts. Where do we want to go with it? Well, our goal is we want to have competent osteopathic physicians that can diagnose and use an appropriate structural exam, understand somatic dysfunction, and comply osteopathic manipulative treatment that's appropriate to their area themselves. And think of clinical situations that they can add this to, and getting that. When you look at requirements in the accreditation standards for our training programs for our schools, they want to look at different things with our osteopathic concepts. They want to look that we can demonstrate that we're utilizing it. We want to show that we're promoting it. And and teaching it in different forms and evaluating it to make sure that we're getting through that. Demonstrating it is one area themselves where we can go through, and just in our actions. Sometimes just the idea that for having grand rounds to say, I expect to have some caveat that at least discuss osteopathic concepts associated with that. And that helps with our promotion. Telling them that this is important. I expect people, this is an important part of your curriculum, it's important part of your identity, and we need the people in the leadership of education to really acknowledge that. And that impacts our whole teaching, and to make sure, again, the right tools to evaluate it. And kind of appealing to everyone who is an educator, because we have a tremendous responsibility. And how we impact our learners is very important. When we're doing osteopathic concepts and we're teaching osteopathic manipulative treatment, this is not just here's just a procedure to do. It's honestly a whole modality that's unique to our profession to help train our patients themselves. And we have to look at different situations that this may be helpful for our patients in going through it, and to think of that. So look at the philosophy behind it and understand why we're doing it, and asking why. There are different models that also help us, even in very busy clinical situations, that help get evidence. The 5-minute preceptor model is also a wonderful application that we can apply to looking at enhancing osteopathic concepts. Again, you look at themselves with the commitment from the learner. What's going on? You pull up supporting evidence. How could osteopathic concepts be here? The why. Teach a general rule. And that's your chance to learn and to give them that general thing about how they're thinking and going through it. If they've done things well, reinforce that, and again, correct mistakes so they know what not to do. Again, getting beyond just a technique, have them describe the role of the musculoskeletal system in health and disease. So if the patient comes in for heart failure, for example, this would be a good opportunity to say, did you notice any areas of somatic dysfunction that are typically associated with individuals who have cardiac disorders? Picking themselves, any alterations of body framework themselves, trauma situations, someone who has low back pain, what has occurred to themselves, how's it impacted the patient's well-being and going through that. And then look for the different levels. Again, we're guiding learners. We're starting with novices. We're trying to develop them to be competent, and we want to move them to develop expertise. But that first tier is someone coming in and saying, well, describe the indication contraindications to using osteopathic manipulative treatment. Fundamental approach. Once they've got through that first tier, go beyond it, and look at the situation. Well, why is OMT really indicated in this setting? Get them to think, to look at that. And let's say themselves, would another modality, not be indicated? So maybe there's a situation where you have a frail person coming in with pneumonia, and you've seen a number of studies that have occurred that have showed that's beneficial. But you say you're concerned about the age group using very aggressive techniques. That's a good opportunity to work with the learner and say there are other ways you can treat this and other modalities. And go beyond contraindications. Is there an absolute contraindication doing that themselves? And maybe in their mind they're thinking, well, all I know is these very aggressive techniques. And say, no, there's other ways to do it. Those are helpful in certain situations, but not here. So kind of moving the learner beyond themselves. And looking at all the methods. Can this clinical situation allow utilization of multiple OMT methods? So when you may have a patient there in front of you to say, what things can be helpful for this patient, and why would this, why would not? So again, you may have a situation where someone is elderly, or they may have a relative contraindication to using aggressive manipulative treatment, but they may benefit from other gentle modalities themselves. Or there may be a situation where they're an athlete that you may say, gee, in order to get more successful outcomes, we should look at using a more direct modality to help with this. And you may find learners that may be resistant to doing things and probing on that. Many times it's because our learners are uncomfortable with things. And that's where you can say, you know what, there's many ways to approach this. Don't make people feel bad about that. Say, maybe you're not comfortable with this modality. Well, guess what? There are dozens of manipulative techniques and modalities. Consider using the other ones to help with that. And then, my role as Director of Medical Education, I'm always chasing documents all the time. And so I remind our learners all the time, now remember, every patient we're admitting, we're getting a structural exam, aren't we? Of course, I know that's not always happening in a real world like that, but to encourage that, but each time let them know it's important, and to make sure that they're doing that, and, to kind of follow through. Because if you don't kind of insist upon it, learners go to the path of least resistance, and in medical training, it's very busy and themselves. So I think we've got to insist on what we feel is important. And then also, you want to go to the next level themselves. Do they demonstrate medical knowledge of the use in different conditions, but not just low back pain or neck or structural problems, but again, that patient who came with heart failure, a patient with pneumonia, and looking beyond just musculoskeletal disorders, and then taking some time to kind of talk about what things we can see in these conditions and going through that to make the learner kind of conscious of that. When you're evaluating themselves, you want to make sure there's an ongoing evaluation. And that is to make sure that, first of all, people are performing things and do that through all years of training themselves and skills. Many times when if you have a course, or you're having even in the midst of residency or students and you're having a class and doing something, having an evaluation form to make sure they're going through and doing things and make sure that they're performing techniques or training to document that they're progressing, and also an expectation they should be performing things and doing it themselves. Again, making sure it's measurable. While the schools have practicals, which is very helpful. In our postgraduate training programs, we find other methods that are doing that. And also documentation, they're even documenting and doing that. And make sure they're keeping logs of things that they're doing. So we've really viewed a lot of concepts in trying to look at procedural skills. Procedural skill training is an essential part of medical education. In osteopathic medical education, we also have the unique procedural skill of osteopathic manipulative treatment and applying that. There are some unique things that we can think about as teachers in osteopathic medical education that may help us to reinforce this. Really, the key one is really our attitude and our ability to promote that and advocate for it, telling learners this is important and we value it, and to really heighten being an osteopathic physician and what we're about. I'm a huge fan of nepotism, so I just have one little kind of ending quote from kind of my greatest mentor. If circumstance limit their therapeutic modalities and isolate them from the many effective remedies of this medical era, they still have their hands, which by their talented maneuvers can return structural integrity and physiological stability to perverted tissues. For those are the hands of an osteopathic physician. And my father wrote that in the Osteopathic Monthly in 1951, and that was a picture when he was an intern at Doctors Hospital in Columbus, but always advocated the power of our hands and what we can do. And our learners have that potential in their hands, and we, as osteopathic educators, are responsible to help make sure that that goes forward to helping to take care of the patients that we are entrusted to. Thank you.